Heart attack is a condition which can range from being very benign to something which is quite fatal. So it can be as small as a silent attack where you just have a feeling of intense dyspepsia or burning sensation in your chest, pain in your neck, and it can go up to a case where there is a sudden loss of blood pressure where you collapse and become unconscious. So it is diagnosed by three things. One is how the patient presents himself or herself. Second, things are picked up in something called an ECG, where wires are attached to your chest and we record electrical signals from the heart. And the third being certain blood tests known as biochemical markers. When two of those three come together, then we diagnose that a patient has suffered from heart attack. There are a lot of conditions which can lead to a heart attack in a young population. Usually, we term these as conditions leading to SCD or sudden cardiac death. One of the most common conditions is in athletes that they have something called a myocardial bridge. So, when they are exerting themselves, when their heart is beating faster, because of a muscular problem, suddenly the blood supply to the heart is cut off. And this can cause a sudden heart attack. We see this also in people who run marathons, the various marathons that are being organized by various institutes have these young people running in them and suddenly they succumb to a sudden cardiac death. Also, if there is a family history, if somebody in the family has had heart attack, then we have seen that there is a greater chance that the subsequent generations can have a heart attack at a younger age group. Unhealthy lifestyle, stressful lifestyle, consumption of too much of junk food, all these things, along with a more sedentary lifestyle and increasing obesity and diabetes in the young, can contribute to a higher chance of having heart attack in the younger population. The precursor to heart attack or the dawn before the morning is angina. Now, what is angina? So, suddenly an individual might start feeling discomfort in the chest. And this discomfort can be as if somebody is putting a pressure on the chest, somebody is tightening a belt around the chest. There can be a feeling of somebody's poking a pin or a knife into the chest. Also, sometimes it can present as a burning sensation in the chest, going up to the neck, going to the back, going to the left arm, and in rare occasions to the right arm as well. So, this is angina. Usually, it is relieved by rest. Sometimes it is relieved by medication. Sometimes it keeps on coming with increasing frequency. The interval between two episodes keeps reducing. Then it is called unstable angina, and usually this is a precursor to having a heart attack. Now, when a heart attack comes, like I said, it can be very benign. It can be just like an angina, or it can be very severe where you suddenly collapse, where you are taken to a medical emergency and you need help within a very short stipulated time to be able to save. When you are brought into a hospital with a possible heart attack, the emergency physician there will rely on three things to diagnose you from heart attack. Number one is your presentation. If you are conscious, you can describe your symptoms, which can be discomfort in the chest, pain in the chest, sudden head reeling to the physician. If the patient has collapsed, then the people attending to the patient usually describe his condition before the collapse. And secondly, he will do something which is known as an ECG, electrocardiogram, where few wires will be attached to the chest and he or she will record the electrical impulses from the heart. Altering electrical impulses or abnormal electrical impulses can indicate that you have heart attack. That is a bit technical and specific as to what electrical impulses can be generated in heart attack. Third is they will send a spot test, which is known as TROP-I or TROP-T. It is a marker that is released when the muscles in the heart suffer serious injury or when a heart attack occurs. And when these are positive, along with changes in ECG, along with symptoms given by the patient, then a diagnosis of heart attack is made. First thing is when a heart attack is suspected, you must not try at all to treat at home. You must immediately rush to the nearest medical emergency so that the treatment can start. There is a golden period. If the treatment, an adequate treatment, is given in this golden period, then the chance of recovering from a heart attack is excellent and the prognosis is very good. It is usually when there is a delay in seeking medical help that the sequelae of heart attack kicks in and patients have a poor prognosis or life-threatening situations. Now, the treatment depends upon the center. If you're going to a center which does not have an equipped cardiac facility, what they will do is give you some oral medicines, and if they have the facility, they will give you a special injection. This can sometimes relieve the heart attack. and then they will send you to a tertiary center. And if you are fortunate enough to land up in a tertiary center, then you will be, after stabilization, taken up for something called a primary angiogram, where depending upon what they find, they can do a primary angioplasty or a stenting. And if it is seen that primary angioplasty cannot be done, but a lot of the heart is at risk if something immediately is not done, then you are taken up for something known as emergency coronary artery bypass grafting, which is a heart surgery. Rather than how to prevent a heart attack, we must try to prevent the heart disease, because heart attack is actually the end stage of a highly progressive coronary artery disease. So we must try to prevent the onset and the progression of the coronary disease. Now let us divide it into two kind of populations. One, the younger one, and the other one is an older or the geriatric population. Well, of course, the older the geriatric population need to make sure that they are undergoing regular health checkup. Their sugars, blood pressure, their cholesterol is all under control. They are not obese, and if they are, then they should seek help to reduce their obese, reduce their body mass index. And if they are on cardiac medications, they must regularly take these medications and be on regular follow up with their doctors to make sure that the disease is not progressing. And if it is progressing, to quickly address the disease, to quickly revascularize the heart so that heart attack does not occur. Now, for the younger population, if there is a history of heart disease in the family, the younger generation has to be very aware. If there is even slight discomfort in the chest, they must seek a physician's help, undergo relevant testing, and this kind of an illness can be diagnosed quite early and can be treated quite early with really good results. Problem occurs when it is ignored. Most commonly, it is ignored because people feel it is gas or dyspepsia. And then they seek treatment for dyspepsia, which really does not stop the disease or the progression of the disease. And then they land up in trouble. Maintaining a healthy lifestyle, having adequate sleep, having a healthy food, having a less stressful life or adequate relaxation if the life is quite stressful is also very, very important for youngsters. Usually, a stressful condition with lack of sleep and mounting peer pressure with a sedentary lifestyle are the things that contribute to an acceleration in the coronary disease. And this kind of an acceleration is actually a harbinger to the heart attack. So, if we try to address the root cause and modify our lifestyles a bit, we can control and win over our coronary disease, and thereby we may keep the heart attack at bay and have a healthy life.